It's HIMSS 2018 right here from Las Vegas, Nevada, as we go ahead and introduce you to some of our CommonWell Alliance members. Time now to hear from eHealth Technologies as their CEO and President Ken Rosenfeld join us. Scott Adams here with you. And Ken, what is eHealth Technologies' area of expertise, and how do you guys envision your contribution to improving nationwide interoperability?
Thanks. We have actually a new saying that's get well informed. And what we do is we ensure that patients that are referred for advanced specialty care to actually the majority of the top hospitals around the country, they go in for cancer, transplant, or cardiovascular disease. We make sure we collect all the clinical information. This is documents, images, pathology, pull it all together, deliver it to the institution, often directly into their EMR, into their PACS and their imaging systems. So when that patient arrives, the clinician is fully informed as to what they need to know about that patient. And that effort requires us to collect all types of information, right? Not just selected elements, because they need to know, operative notes and what happened with radiology diagnoses and pathology reports, et cetera. And so we make sure all of that's there, organized, curated, and delivered specific to that specialty area. So whether it be for cancer or like prostate cancer, it's all organized in a way so that oncologist has the information at his fingertips in a way that makes sense so he can learn that the patient's story and better treat that patient.
eHealth Technologies, you guys have been with CommonWell now here for a couple years. Why the partnership? Why did you guys decide to go the CommonWell route?
Well, one of the things we've learned, we've been around for 11 years, and one of the things we've learned is when clinicians are well informed and they have all the information that they need to care for the patient, the quality of care goes up. And the speed to treatment also goes faster. So we actually had one of our customers show that for surgical oncology, they were able to reduce the time from appointment to treatment from almost 3 weeks to under a week by ensuring that clinician was well informed. From a CommonWell perspective, we know that the quality of care improves when you have all that information. Patients go to lots of different care providers for their care, and so we know how critical it is to have that nationwide interoperability, to have access to that information, and we believe CommonWell is particularly well positioned to support that improved quality of care by tapping into all this information and making sure it's available to physicians. I mean, at the end of the day, it comes to caring for patients better. And our mission and CommonWell's mission is very aligned from that perspective of making sure they have access. So we want to be a part of that. We want to partner with CommonWell and help drive this forward.
Okay, and speaking of driving that forward, interoperability here, maybe moving forward in the next 5 or 10 years here. What are your thoughts? What is eHealth Technologies' thoughts as we move forward here together?
Well, one of the key things are, we've made progress with interoperability. There is information that's accessible that's largely captured in a clinical care summary. So, you'll know the problems that a patient has. You'll know their medications and their allergies and their care plans. And that's great. That's very, very useful. The patients that we deal with are really the sickest and the costliest patients to the system. And in order to treat them, you need the whole spectrum of longitudinal information about that patient. So what we would like to push for is ensuring that there's more access enabled to the full medical record for the patient, not just a clinical care summary that might be captured in a CCD or a CCDA, but actually capturing a lot of that unstructured data or the text or the narrative that is so important to understand what has previously been done with that patient and critical to their future care. So that's what we, multiple conversations with CommonWell on how do we start to open up the flow of information to that full medical record. We kind of say, let it flow, let it go. It doesn't all have to be so completely structured because there's tremendous value in all of that information.
And we've seen the growth now here over the course of the past 5 years. CommonWell starting there in 2013, now a 5-year anniversary. And having more of these members like yourself on board going into the future can help assist in making that goal attainable.
Absolutely.
Yeah,
absolutely.
Awesome. Very good. eHealth Technologies, one of our proud members of our CommonWell Alliance group. Thanks so much here this morning.
Absolutely. Thank you very much.
And for more information on eHealth Technologies, we invite you to log on to CommonWellAlliance.org.